This is a case of Langerhans Cell Histiocytosis, or LCH, of the pituitary gland and infundibulum in a 6-year-old male. The first image is sagittal T1 weighted with some motion degradation. It demonstrates thickening of the infundibulum and pituitary gland itself with classic loss of the typically hyperintense posterior pituitary. The noncontrast coronal T1 correlate redemonstrates the infundibular thickening as well as enlargement of the pituitary gland itself. The third image with T2 weighting in the coronal plane redemonstrates the thickening of the pituitary stalk. The multiplanar postcontrast T1 weighted sequences demonstrate avid postcontrast enhancement of the markedly enlarged infundibulum and pituitary gland itself. LCH is a reactive clonal disease of monocyte-macrophage system and may affect almost any organ system. LCH CNS involvement may fall into one of several forms such as osseous lesions with or without soft tissue components, intra-cranial, extra-axial lesions such as in the hypothalamic-pituitary region, meninges, or circumventricular organs, intracranial, intra-axial lesions, and cerebral atrophy. LCH is the most common cause of infundibular thickening in childhood. Diabetes insipidus is the typical clinical presentation of hypothalamic-pituitary involvement.